Hello, viewers. You're welcome to the show again. Today, we want to talk about something very interesting. We want to talk about something very common. So, today, we want to talk about the disease called asthma. We'll talk about asthma. In this lesson, we're going to look at the meaning of asthma. We're going to look at the symptoms of asthma. And we are going to be looking at the management of asthma. Are you ready? Okay, let us begin. Okay, so what is asthma? Asthma is a condition in which the airways swell and become narrow. This swelling may be as a result of fluid buildup such as mucus in the airways. Okay, and then this makes breathing extremely difficult. Okay, so let's talk about the airways now. What do I mean by the airways? The airway simply means the channel through which air passes to the lungs. So all the organs through which air passes to the lungs are referred to as the airways. The airways is actually divided into two. We have the upper airways and the lower airways. Okay, so the upper airways consist of the nasal cavity, the pharynx or the larynx, which is also called the voice box, while the lower airways consist of the trachea, which is also known as the windpipe, and the bronchi. Now, the bronchi are the organs that lead air to the lungs. Singular bronchus, plural bronchi. Okay. Asthma actually occurs when the bronchi gets swollen and then narrow. This may be as a result of fluid buildup in the bronchi. This fluid buildup may be caused by inflammation of the bronchi, thereby making the passage of air in and out of the lung difficult. That is actually what leads to asthma. Okay, so now what are the symptoms of asthma? The symptoms of asthma varies in people as different people may experience different symptoms. But the most common symptoms of asthma are difficulty in breathing, that's shortness of breath, dyspnea, that's dyspnea. Because the airway is narrowed, it makes passage of air in and out of the lung extremely difficult. That makes breathing difficult. So one of the symptoms of asthma is shortness of breath, that's dyspnea. Okay, another symptom of asthma could be tightness of the chest or a kind of burning sensation or pain in the chest. Okay, some other persons may experience symptoms like wheezing. By wheezing, I mean a kind of whistle-like sound when breathing. And of course, one of the major symptoms of asthma is cough. Some other persons might also experience difficulty in sleeping due to difficulty in breathing. That's insomnia. Okay, now we have known the symptoms of asthma. What actually causes asthma? The cause of asthma is not really clear, but asthma could be caused by a combination of environmental factors or genetic factors, meaning that it could be hereditary, that it can be passed on from parents to offspring, or it could also be environmental factors like smoking, maybe inhaling irritants, being exposed to certain gas that affects the lungs. Okay, now we have known this. The next thing we have to look at now is what are the things that trigger asthma? Because asthma can actually be episodal, meaning that it can come and go. So what are the things that triggers asthma? Now, so many persons have different triggers. What may trigger a patient may be different from what will trigger another patient. But the most common triggers of asthma, number one, an infection called cold or flu. So a flu or infection or cold can actually trigger asthma. Another thing that could trigger asthma is physical exercise. Some persons experience asthma flare-up whenever they get engaged in strenuous activity or serious physical exercise. Okay. And also some other persons can experience asthma flare-up when they get exposed to certain irritants like smoke, dust, or even perfume as the case may be. Okay, now we have looked at what triggers asthma. The next thing we have to look at is how is asthma managed? How is asthma treated? Sadly, asthma cannot be cured, but the symptoms can be greatly managed, at least to the bare minimum. Okay, it's not so much a deadly disease as a patient can actually lead a normal life even with asthma, provided that the irritants are being discovered and prevented. Okay, so how can they be treated? Well, treatment is geared towards identifying the triggers and staying away from them, and also trying to get in as much air into the lungs as possible. This can be done with the use of drugs such as bronchodilators. What do I mean by bronchodilators? Bronchodilators are drugs that actually dilate the bronchi, that is, expands the bronchi, relax the muscles, and then allow the easy passage of air in and out of the lungs. Okay, since the bronchi is the organ that is heavily involved in asthma, the mainstay of treatment here or treatment of asthma is geared towards allowing the free flow of air into the lungs. And this can be achieved by the use of drugs called bronchodilators. So these bronchodilators try to relax the muscle of the bronchi and allow easy passage of air in and out of the lungs. And of course, since it is majorly caused by inflammation, the inflammation also has to be addressed. So the major bronchodilators that are normally used in treating asthma are a group of drugs called beta-agonists. Okay, so beta-agonists are drugs that help to dilate the bronchi. And there are so many examples of beta-agonists. We have the albuterol and we have the levobuterol. Okay, these are some examples of drugs that are commonly used. Okay, they can come in form of tablet or can be taken with the use of inhaler. What are inhaler? An inhaler is a small device that takes in drug directly into the lungs. Okay, so this drug help to do what? To dilate the bronchi and make and make passage of air into the lungs and out very easy. Okay, so that's how asthma can be treated. But then one very important aspect of treating asthma is to identify the triggers and then trying to avoid them. Because if you avoid the triggers, then of course you can actually avoid the flare-up of asthma. Okay, so that is all today. I hope you enjoyed our class. Till when next to me, thank you very much and God bless.